The power of spirituality allows us to explore with ourselves more deeply. It is considered a valuable resource for improving the quality of mental health, inner strength, and personal fulfillment. Depression can deplete mental health in a variety of ways. According to my medium-sized class survey, 30% of college participants had struggled to view the future with optimism and were unfulfilled on a day-to-day basis. Spiritual practices can be used to help individuals cope with these depressive symptoms. Symptoms related to depression have negatively affected my life and also the lives of other college students. From my experience, spirituality has helped me control the ways depression has negatively impacted me. I have done extensive research on the ways spirituality has positively contributed to mental health, well-being, and recovery. Today, I will elaborate on the ways students should take action to improve their depressive symptoms. First, students experience and endure depression. Second, my solution strengthens mental wellness. And third, we will finally visualize my solution. To begin, I will go into greater detail on the dangers associated with depression. Depression is the most common mental health disorder among college students. Students are at risk of experiencing these symptoms based on stressors of academic life and major life transitions. According to the Journal of American College Health in 2018, 15% of college students were diagnosed with depression. Additionally, cases of untreated mental health disorders are risk factors for suicide, which is the second leading cause of death among college students. According to the American College Health Association, students who endure depression are also likely to struggle with educational outcomes and relationships. A national case study showed that these students were less likely to complete and graduate from college. Depression is a prominent issue worldwide that is considered a major public health concern. According to the Journal of Collaborative Family Healthcare, approximately 50% of depressed individuals receive no treatment, while only 20% receive adequate help. Students who suffer from depression may not be receiving adequate enough help to help them recover. 30% of respondents to my survey may be suffering from more symptoms besides unfulfillment and uncertainty that were not listed. Now that I have elaborated on the dangers associated with depression, I will explain a constructive solution to this rising problem. One of the most typical solutions to treat depression is to receive medication, commonly known as antidepressants. These are designed to restore chemical imbalances. They are proved to be effective for only chronic and severe depression, not for patients with mild depression. Patients who choose antidepressants will have a difficult time in finding the best medication that works for them. It could take months based upon trial and error. And with all medication comes potential side effects. There is no way to avoid adverse and unwanted reactions. Although medication can be beneficial for some people, it is unsure whether or not these methods are effective enough to treat the severity of depression. According to the Mental Health Foundation in 2020, these mechanisms include coping styles, locus of control, social support, and physiological methods. Researchers argue that the emotions encouraged in most spiritual practices include hope, contentment, love, and forgiveness. These emotions positively affect the neural pathways that are linked to the endocrine and immune systems. Implementing these emotions can give meaning and directions for depressed individuals. Incorporating my solutions into daily customs will positively benefit anyone exercising it. According to the Journal of Spirituality and Mental Health in 2018, research proves that there is a positive correlation between practicing spirituality and treating depression. Their studies show that spiritual individuals have lower levels of depression, hopelessness, and suicidal ideation. Some people believe that there are research limitations that rely solely on quantitative measures. First, research and evidence can be gathered to fully assess the meaning of spiritual activity. The evidence provided against using spirituality as a solution is irrelevant. Qualitative and quantitative measures both offer insight into the correlation of how spirituality positively contributes to mental wellness. Secondly, it does not take just quantitative measures to prove that spirituality works. There is a substantial amount of evidence that links spirituality with an enhanced mental state. The argument against my solution is based upon drawing conclusions with illogical limits. Research on spirituality can be easily improved to help those who are in desperate need. Lastly, considering that there is an ample amount of data that shows the positive correlation, there is no justification for not implementing it or for at least not trying it. After analyzing data from my class survey, approximately 70% of students had turned to spirituality to help them cope with the problems that they faced in life. And practically 86% of participants had agreed that spiritual practices had improved their certainty, happiness, and idealism in life. Since most students who participated in my survey have been introduced to or already practice spirituality, it is evident that they can use this knowledge and faith to help them fight feelings of depression. After analyzing my suggested solution and the complications that may come with it, I will continue by describing the possible future of depressed individuals. It is possible that you completely refrain from the information provided today and continue routine as is. Consider the possible outcomes that come with this decision. You could decide to not take internal action and continue to be in pain. Or you could take advantage of the medical treatment available, but may suffer from the highly potential side effects and the expenses that come with maintaining the correct doses. On the other hand, imagine the benefits of implementing spiritual study in everyday life. You will learn how to effectively apply concepts of spirituality to improve and cope with depression. You will be satisfied with elevated levels of optimism, fulfillment, meaning, and purpose. And finally, you can utilize your inner power to reduce the amount of agony that comes with depression. Genuinely envision both possible outcomes with treating depression and take into consideration what can benefit you from just months of practicing my solution. Lastly, I will discuss the daily use of spiritual practices. Today, I have attempted to persuade you about the solution to depression. First, students experience and endure depression. Second, there is a constructive solution to this problem. Apply concepts of spirituality to everyday life. Lastly, if you do decide to implement spiritual practices, you will eventually obtain the inner power and control needed to create resilience against fighting depressive symptoms. Now, I want to ensure action by sharing the best ways to apply spiritual study to everyday life. Stay in the present moment. Focus on the things that you can control. Implement meditation, mindfulness, or prayer into your routine. This can be as simple as taking a moment to yourself to recollect your wandering thoughts. Give meaning to events and experiences and determine why these experiences are special to you. Practice on perceiving negative events as externally caused and positive events as internally caused. This is notably the mindset of optimism according to the Mental Health Foundation. And finally, do some research on which coping styles best work for you. Now, imagine a world where suffering individuals are able to effectively combat depression with their achieved mind power and are now more capable of succeeding in multiple aspects of life. This can be you. And here is my speaking outline.